The difference between single and dual chamber ICDs really boils down to the amount of information you get. The controversy that relates to whether patients should receive a single or dual chamber defibrillator, I think is going to be laid to rest with the DX leads and the ability to have sort of the best of both worlds, atrial diagnostics and a single lead device.
When you look at the NCDR registry, you will find out that actually patients who underwent dual chamber ICDs had twice the number of complications as compared to single chamber ICDs. There was additional risk of damaging the lung, pneumothorax, or perforation of the heart, or lead dislodgement.
But one factor that's not thought about a lot is that the more leads that are in the vascular system, the more likelihood that there's going to be venous thrombosis and potentially sequelae from those occlusions.
You're adding to the procedure time, and you're adding to some complexities associated with those procedure times.
When we choose a traditional single chamber ICD, we really sacrifice the atrial lead diagnostics. We don't have a crystal ball to know who's going to have atrial versus ventricular arrhythmias.
There is a possibility that the device will give inappropriate therapies for something which was a benign arrhythmia and not really required a shock or pacing therapy. If you put BIOTRONIC's DX system in that whole picture, that is the ideal of both worlds, because you're not adding hardware to the system. Your procedure complication does not change because it's essentially a single chamber device, where you're giving the diagnostic accuracy of dual chamber ICD system. I can prevent inappropriate shocks in these patients even if they go and work out and try to live a close to normal lifestyle.
Home monitoring is excellent adjuvant therapy with the DX system. It also gives the patients a big sense of reassurance that we're kind of following what's going on, and I think the BIOTRONIK home monitoring in particular is an advantage because it's updated daily.
Everybody is an ideal patient for DX for primary prevention of sudden death unless they have a clear-cut pacing indication.
It gives me the best of both worlds. Excellent longevity, excellent track record, reliability, a device that I'm comfortable with, that's really easy and quick to implant, but also provides me that atrial diagnostic information that I don't know if I'll need today, but I may need tomorrow.
The opinions, procedures, and results expressed or depicted in this video are those of the physicians featured and do not necessarily reflect the opinions, policies, or recommendations of BIOTRONIK or any of its employees.